My name's Steve Wolf, CEO of Indiana Regional Medical Center, and we're so excited that you're going to be able to join us while we review our last 100 years. We also look excitedly to the future and what's next for Indiana Regional as we want to continue to thrive and grow and be the best community hospital in the country. So many men and women and volunteers who have given their life and their dedication and sacrifice to really make this event even possible. Special thanks to our friends at IUP TV and Dr. Pawinski and all the students who helped to make this quality product available. Enjoy.
This is Indiana Regional Medical Center. With facilities in Indiana, Chestnut Ridge, Marion Center, Northern Cambria, and Seward, we provide the community with quality, progressive, and compassionate patient care. As we celebrate 100 years of service, let's look back and see where we began. Medical services in Indiana County began with Dr. Jonathan French, who served the county from 1807 to 1814. Today, Dr. French is buried in Memorial Park. In the early 1900s, coal mining and the railroads helped fuel a new round of economic expansion in the Indiana area. The New Century Committee, formed in 1902 to help plan the county's centennial celebration, would become a leading force in the effort for a modern hospital to serve the region. In 1903, the Indiana County Hospital Association was created. A.S. Cunningham, a local businessman who owned the mercantile store in the 600 block of Philadelphia Street, offered 3 acres of land for the hospital. The Buffalo, Rochester, and Pittsburgh Railroad, along with local coal companies and railroads, announced their support. With the endorsement of the New Century Club, the Hospital Association was revised in 1907 and intensified its efforts. The revised association was one of the first organizations to provide women an equal voice on its board with 15 men and 15 women. In 1907, the association prepared and submitted an application for state funding. Unfortunately, the request was denied and the effort stalled. In 1912, the effort restarted with a new intensity. An unnamed businessman pledged significant funding if the community would raise $10,000 towards the project, which was to cost $60,000 or more. John Elkin, John Fisher, Henry Hall, A.S. Cunningham, and C.M. Langley comprised the subcommittee that helped spur the new effort. The project received a major boost when Adrian Island of the Rochester and Pittsburgh Coal Company, the unnamed businessman, came forward and pledged $40,000 towards the hospital building. A 54-acre tract of land, the site of the present hospital, was acquired from the George C. Dickey estate, a local businessman who died of pneumonia at age 62 in February 1912. On October 29, 1914, the Indiana community sees its new hospital dedicated. The 3-story structure, a gift from Adrian Island and his sister Georgine Island, cost $125,000 plus an extra $16,000 for equipment. With the new facility ready, attention turned to the staffing and equipping of the facility. This included hiring a superintendent, Ms. Sarah M. Morgert Leventry, and a directress of nursing, Miss Eliza B. Dill Wyman. In 1915, through the donations of the Island family, the hospital acquired a motor ambulance and X-ray machine. On New Year's Day, 1915, the first class of 14 students began their studies at the hospital's nursing school and would graduate in January 1918. On February 11, 1916, the new hospital faced its first critical test as an explosion at the Ernest Mines killed 27 miners. The hospital's response helped demonstrate its importance to the community. During the First World War, The hospital played a significant role in treating soldiers returning from Europe. Many soldiers were served at the hospital. Both Sarah Morgert and Eliza Dill, along with 6 other nurses, would serve with the Red Cross or the U.S. Army, most at the Walter Reed Medical Center, working with wounded soldiers. As the war ended, returning soldiers brought home a deadly souvenir, the Spanish influenza. An estimated 500 million people worldwide were infected, with some 50 million deaths. In the first month, Pennsylvania saw 24,000 deaths. The state had the highest mortality rate from the pandemic in the nation. Indiana did not escape. By October of 1918, Indiana recorded over 100 deaths from this disease. To handle the pressures of the epidemic, the porches at the hospital were enclosed to provide additional space. In the 1920s, the hospital continued to grow, increasing the size of the nursing school, becoming a member of the American Hospital Association in 1926, and opening its first operative clinic in 1927. In October 1926, a diagnostic clinic focusing on childhood polio was held with the support of the Indiana Rotary, and in its first year would treat 236 children. As the 1920s were drawing to a close, Indiana's hospital was established as the central healthcare provider for the region, but its growth was just beginning. By the late 1920s, Indiana Hospital emerged as the cornerstone of healthcare for the region. Over the next 70 years, it would undergo 4 periods of growth that established the foundation of today's IRMC. Despite the stock market crash of 1928 and the Great Depression, Indiana Hospital continued to grow to better serve the healthcare needs of the region. With the growth of prepaid hospitalization and health insurance in the 1930s, a wave of expansion began as hospital admissions increased. To respond, the Junior Auxiliary was formed with an emphasis on providing support for children and maternity cases. In 1931, the first new wing was added, increasing capacity to 154 beds. A major supporter of the expansion was John G. McCrory, president of a chain of 5 and dime stores. At the same time, the Dixonville Hospital closes and donates its equipment to Indiana. Membership in the Hospital Association of Pennsylvania and its first electrocardiograph machine followed in 1934. But the hospital was not large enough to apply for interns or to issue diplomas to its nursing students. John S. Mack, president of G.C. Murphy Company, became a driving force to address this deficiency. In 1935, Mack donated 1,500 shares of Murphy's stock to the hospital. 1937 saw the opening of a new nurses' home that included a dietetic training kitchen. In 1939, a second wing opened with 50 new beds, raising the hospital's capacity to 200 beds, 5 times its original size. The Mack wing was designed by local architect Robert E. Tom. Mack's donations included funding to serve those unable to cover the cost of hospital care. In 1938 through 39, over 3,800 patients were treated, with some 1,500 admitted as free patients. With this growth, the hospital could now apply for interns and award diplomas to its students. Polio had long been a major threat, striking numerous people per year, mostly children. President Roosevelt was a victim of the disease. To treat its victims, the hospital acquired its first iron lung in 1942 with the support of community donations. As war spread following the attack on Pearl Harbor in 1941, Indiana Hospital developed a plan to mobilize staff and serve as an emergency hospital base in the event of an attack on the country. With the post-war period came the baby boom. As the population grew and medical advances occurred, the hospital entered a new period of expansion. In 1958, a 10-year modernization program began with a new diagnostic and outpatient wing. Then, in 1966, a third floor was added to this new wing for maternity cases. The new wing would include radiological and fluoroscopic services, surgery and recovery rooms, the kitchen and cafeteria, and other facility support areas. With continuing advances in medicine and the launch of Medicare, the late 1960s saw Indiana Hospital establish in-service education for nursing and compliance training. As a result, the nursing school gained recognition and accreditation from the Board of Diploma Programs of the National School of Nursing. On July 30, 1970, the Visiting Nurses Association was officially organized under the sponsorship of the Alumni Association of the Indiana Hospital School of Nursing and the Women's Civic Club of Indiana. The program would provide at-home services and enable many to remain at home while receiving medical treatment. On Thanksgiving Eve, 1976, a fire struck the nurses' quarters, destroying the complex. While there were no serious injuries, changes in nursing preparation would see the closing of the school. IUP's growing nursing program would fill the gap and become the region's main area for nurses training. The hospital continued to grow, and in 1976, ground was broken for a new 7-story addition called the Tower. In 1979, patients were transferred to the new facility and renovations of the older buildings began. Growth continued in the 1980s with a diagnostic facility in Blairsville, along with the Cancer Treatment Center, the Indiana Dialysis Center, AGH, a partnership with Allegheny General Hospital, and a new maternity facility providing family-centered care. The 1990s saw the MRI, new cardiac and cancer treatments, and the opening of a new outpatient services building in 1992. The progression from its original ambulance to modern EMS care would literally take to the skies in 1994 with the collaboration of Allegheny General to bring Life Flight to Indiana. The late 1990s would see a transitional care facility, sleep disorder center, and bone density testing would be added along with family medicine centers in Cherry Tree, Plumville, Northern Cambria, Mahoning, and Homer City. For more than 60 years, the Indiana Hospital School of Nursing graduated more than 900 nurses and was a great source of pride for IRMC. The school was open from 1915 until it graduated its last class in 1979.
The nursing school opened in 1915. The hospital opened its doors in 1914, I'm sure you're aware. And the first class of nursing students graduated in 1918 with 12 students completing the course. And then the last graduating class was in 1979, and there were 19 students in that class.
For enrollment, the only requirement was a high school diploma. No entrance exam was given and tuition was free. However, they were put on a probation period for 3 months. The 3-year nursing students overwhelmingly made up most of the hospital's workforce. They worked 12-hour shifts from 7 a.m. to 7 p.m. The first teachers were hospital administrator Sarah M. Morgert and director of nurses Eliza Dill Weinman, with staff doctors lecturing occasionally. Nursing uniforms have evolved through the years. Though changes have come, one thing remained the same. Uniform dress codes were strictly enforced. Originally, nurses wore a blue-striped uniform with a white bib, apron, long sleeves, cuffs, and a starched muslin cap.
Our uniforms were so stiff that they stood alone in the corner. That is the truth. And we would peel them apart on the bottom to get into them. And when we walked, there was this swish, swish, swish. You always knew when a student nurse was coming because of the uniform.
In the 60s, the uniforms were a blue and white checkered dress with a white bib, white hose, and cap. The uniforms were not complete unless the nurse carried a pen, notebook, and scissors on them at all times. The housing for the school was constantly changing and needing to expand. In 1916, a 3-story building was erected to house the students.
It was a 3-story building, and the first level was where the classrooms were, and there was an auditorium there. And then the one wing, the second and third levels, were dormitory-like rooms, and that's where the first and second year students lived. The other wing was for the third year students. And it was dormitory living is what it was.
Several other expansions were necessary over the years due to the continuing increases in enrollment. In 1929, an addition was built, effectively doubling the size of the residence. In 1937, a new nurses' home was built and eventually expanded in 1947. This expansion was partly made possible by donations from Indiana's most famous son, movie star Jimmy Stewart. In the mid-1930s, a very important expansion was planned. Indiana Hospital was too small to be recognized by the state as a complete training school for nurses and to qualify for interns. John S. Mack, owner of G.C. Murphy Company, a chain of 5 and dime stores, put into motion a plan to expand the hospital's capacity. The original idea was to build a separate heating plant to free up space inside the hospital. But when more space was needed, Mack volunteered the money to build an additional wing. The Mack Wing, as it came to be known, was completed in 1939. While this expansion allowed the nursing school to award its own diplomas, it also forced them to start charging tuition to the students. Later in the 1940s, an entrance exam was also made mandatory for admission. The 3-year education of the nurses would eventually come to include 2 semesters at Indiana University of Pennsylvania, 3-month clinical stays at a pediatric hospital, and a psychiatric institution. They were also guaranteed a job upon completion. Many of Indiana's nurses would fulfill their patriotic duty during the 2 world wars. During the First World War, a group of 7 nurses from the Indiana Hospital Nurses Unit trained at Camp Lee before being assigned to Walter Reed Medical Center in Washington, D.C., to work with wounded officers. When America entered World War II, the nursing school was one of the first schools to enroll in the United States Cadet Corps program, which eventually graduated 41 Indiana nurses. Through the years, there have been a number of key women who have helped lead the nursing school to success. One of the most notable was Nettie Beeler, Director of Nursing from 1948 to 1965.
Miss Beeler was a very formative, foreboding individual. She came across as very strict and very tough, and she was strict. However, she was the kindest lady underneath all of that armor, and she loved her students. She would have done anything for us. If we